Hey everybody out there on the web again. It's Robert Funk back again. This time I look a little goofy with my short sleeve shirt, my black tie, and my screwed up haircut. But today I decided to take on a new topic, which I feel maybe some of you out there on the web could benefit from my input on this, or how it's affected me. I'd like to talk a little bit about medication for bipolar or major depressive disorder, as it's also known. This road, it's a traveled road in this country. A lot of people have issues. They go to medication and therapy, try to do the right thing, and wonder why this medication I'm on doesn't seem to be fixing the problem. Well, first problem already. The medication's not going to fix the problem. It's simply going to help you overcome the problem. My problems, they lie within internalized emotions of anger and basically not letting things go for years and years and years that I didn't even know I was still internalizing these feelings, against, even my own father from when I was a child. I had internalized these feelings and they start to eat at you. And then you begin to project these feelings outwardly. And then in my case, I project my feelings outwardly that other people, they get the feeling like, why is he mad at me? Or why is he angry? What's wrong? What did I do? They haven't done anything. The problem lies within me. I'm still trying to get over something from a long time ago because I felt the need. I'd say therapy, talking to people, I'd give it a shot. I gave it a shot a couple times just to appease some people, but my family was telling me therapy, therapy, and I'm yeah, yeah, yeah. Well, it actually helps out. You got to find the right one. Sometimes, perhaps, like I go to the VA hospital for my medication, my psychiatrist. There's therapists there too, but maybe perhaps you don't want the VA to know maybe certain things you want to talk about. For instance, if this happened to you as a child, you're uncomfortable. So you can go out there and look in the phone book, look on the web, and find a private therapist or, private practice and go there. Even if it's out of pocket, it's worth it for that feeling you'll get when you walk out that door and you say, boy, it was about 16 years since I talked about this, and now it's gone and it's out of there. Because if you let it build up, all that black, dark energy, that stigma is going to surround you. It's going to surround your heart. You're going to become hardened to the world because you're not allowing yourself to express human emotion. That's what happened to me. I went about everything the wrong way. In our situation with people like me with bipolar disorder or other mental disorders, and if bad things happened to you as a child, that life wasn't exactly all roses, you tend to lean towards things like substance abuse, alcoholism, just generally self-destructive bad behavior. And it's a key important thing to remember. Everything that goes in your body has an effect on your body, especially your mindset there. You've got receptors in your brain designed to do one thing. And I don't know, everybody has their own little vices, their obstacles to climb. But always consider, if you have an issue like me, how much you could be amplifying your emotional issues by putting things in that aren't necessarily supposed to be there. Nobody knows what's going on with your receptors when your body doesn't know what's happening to me, what's going on. The reaction a lot of people get with things, they think this is great, I'm having fun. You're poisoning yourself. Your body's reacting to the poison and the toxins inside of it. It's trying to expel the toxins. Another danger to that type of road is the band-aid is too effective when it comes to suppressing your emotions and feelings. Drown them out with alcohol. Tomorrow morning they're back, and tomorrow morning they're worse. Not only is the problem still there, you've got to deal with the hangover, and on top of it, I, for one, you have a few drinks maybe, you say something you don't mean, you act like a fool, you black out, then you have to deal with the guilt, the problem to begin with, the hangover, and just generally the guilt of why did I do this? And it's way too easy to say, shit, it piled up on me again, I'm going to drown it out again. Before you know it, the pile, you're standing at the bottom, and you're staring up and you're looking for the top of your pile of problems, but you can't see the top because you've been washing it away with a wave of alcohol or whatever people, It's getting bad out there these days, especially around here. Uh, I'm trying to address the issues in me that made me want to run away. You know, I had problems facing issues. I did not want to be accountable for my own actions, and I still don't want to be accountable for a lot of my own actions. Trying to be responsible and take responsibility for things. But key to this is surrounding yourself with people that are going to back you up and be there for you. Because sometimes you can't do it on your own. You can't do it on your own. I mean, therapy is great for mental health. Therapy is good for substance abuse too. But all that therapy, and you can make all the plans in the world and you can stand by it and say it all you want. But if somebody's going to come into your personal environment and living space with that enemy, and that's what that is, the enemy is the substance or the drink. If it has become an issue, it is the enemy. Cut it out and keep it away. And if you tell them not to bring it around and they do anyway, they don't respect you enough to respect your wishes. They don't want to see you do better. There's no room in your life for that. One day they'll wake up, hopefully. See, a lot of my friends, we've gone through a lot of similar things. We've had some really, really, dark things happen amongst our circle of friends recently because everything was preventable. What happened to some of my friends was preventable. I don't want to say it was weakness on their part. That was the old Robert who talked about weakness and despised weakness. It wasn't weakness. It was a grip. It was a disorder. Got a hold of somebody, and unfortunately they lost. And unfortunately other people don't realize just how real it is out there. Do you wonder what people think when somebody goes down on something? You would say, wow, that's really bad. I gotta stay away and behave myself. I don't want to be around people who expose me to this type of thing, yada, yada, yada. Yet I hear some people say, wow, that must have been pretty good if it did that. If your mind's that twisted already, you need some help. I'll admit, I need help. I'm doing the help thing now. For a while there, I was actually looking into going to a treatment program, because I was like thinking, if I can't handle this on my own, I can't handle it on my own, I'm going to need help. The first thing I did was admit to my mother and my family what I was up to. Once it was on the table, they knew what to look for and backed me up and backed me up. Another key, if you guys want to stay away from the dumbness, is tell your family and loved ones, your friends, how much you hate it. Speak out against it. Because when you want to relapse and slip up, you're going to feel like a hypocrite. You don't want to be a hypocrite, do you? See? Yeah. Strategy works once in a while. If you apply it correctly. But for me, with my bipolar major depressive disorder, I was on a gauntlet of medications. And I wasn't exactly abiding by it, Some medications make me feel great. I'd say I'm great, I'm cured, I'm off the medication. Go right back down 3 times worse than I was before. Fortunately, I'm in a program now with my doctor and stuff. I have to be compliant with the medication. Med non-compliance equals we don't see you for a little while, Robert. But that's a good thing because a guy like me needs that breathing down his neck. One day you wake up and you feel good. I don't need lithium. I feel great. 2 days later, why am I so depressed and feeling this way? And my mood swings. The mood swing is unbearable for your loved ones and people around you, your family. I mean, prior to my levels being where they needed to be, my medication at night, all of that, treatment, this and that. My own mother's, which Robert are you today? You know what I mean? Because just cycling. And if you're a type 2 bipolar, you're rapid cycling. So that lithium medication there, you got to get blood work once a month, which is important to make sure your levels are correct. And I hate blood work. I pass out. I can't stand it. But listen, taking the medication properly as it's given to me and everything like that, staying on the stick with it, It's like night and day and it pays off. I just have to make sure I remain compliant with my program. Because when you're on this medication, the levels are where they need to be. Now, maybe it won't work for you. Maybe you need something else. But if you're struggling with it and you have a doctor, perhaps you should research and ask, maybe is lithium what I need to keep everything level? Because when everything's level, you say, whoa, how did I even live with that before? How did I go through this roller coaster? No wonder everybody around me is saying, boy, something's not right, a little bit off, loco, whatever term, bloody mad. Well, shit, I'd think somebody was bloody mad too if they woke up at 6 in the morning and they're on top of the world and they're creating a new plan. They're going to be a rich businessman, and then at 1 o'clock they want to be a soldier, and at 3 o'clock they look into dark history and look up to negative entities of the past, and you wonder, wow, who is this person? What are they? Who's the real Robert, right? We're working on finding it. I think he's coming out too. I mean, the real Robert is somebody who he wants to bury the negative feelings. He wants the world to go on just fine, and he wants people to leave him go on just fine. I don't like when bad things happen to good people. I don't like to see good people struggle, and I don't like to see anybody struggle. I want people to prosper and be happy. Because now I'm big into karma. Karma is legit. Alright? I'm not saying I do kind acts to people, random acts of kindness, because I expect something in return. I'm saying that I believe that God, whoever he may be, whatever your personal belief is, if you're Buddhist, a Catholic, a Christian, a Muslim, if you're Jewish, whoever your God is, he's going to reward you for it. He'll see that you're making an effort to be human and kind. It's a hell of a lot easier to go through life being a nice guy and kind than it is having everybody hate you. Think about it. Some of the stuff that guys like me get into, who in their right mind wants to walk around in this day and age being interested in the most hated people on the planet, and darkness when it comes to music and literature and negativity. So instead of surrounding myself with that, I decided I'll read a book about positive uplifting, a book on strategy, coping skills. Actually, researching various religions and their takes on things is very enlightening too, seeing how people react, how they feel, and how their belief in their religion actually affects the way they live day to day, both positively and negatively. I've been seeing a lot of positives to the Christian religion, actually. There are really a lot of people out there, they take it. My Uncle Martin takes it to the heart, lives it, breathes it, lives it. Some Islam people, Muslims, my older sister, she takes it to the heart, she lives it, she breathes it, she studies it, she prays it, she abides by it. She doesn't try to push it on me or anybody else. Uncle Martin doesn't try to push the religion on me or anybody else. And if I see the religion doing a positive thing for you, if the Bible's going to make you want to be a better man, well then do it. If the Quran's going to make you want to be a better man, well then do it. However, if that Quran's going to make you want to be one of those guys, don't do it. The original Quran was not anything like. My older sister explained it to me. It's been manipulated throughout time. But that's another topic. This was originally about medication, but I'm talking. But yeah, looking forward to 2014, sticking to the strategy, the plan, and trying to stay positive, trying to feel better, breathe better, eat better, It's looking up, it could. I mean, hope for the best, but expect the worst or whatever. That's what they say. But, I'm looking for constructive criticism. If I'm ranting or raving, if I'm boring, let me know. If you like the videos, let me know. And if you have something you'd like to talk to me about and you'd like to get on topic with me about, let me know. We'll talk about it. I'm more than willing to talk to you guys out there on the web about this, and I'm more than willing to hear what you have to say about this stuff. So everybody out there, have a great day, and it was good talking again. And thank you for listening to this one. I hope it wasn't too painful in the ears. Peace.